It's an honor to be here. Senator Toomey isn't here today, which is kind of disappointing. So I'm actually going to film this and I'm going to tweet it to him so he sees this. I have 3,000 patients that are going to lose health care with the repeal of ObamaCare. I work at a clinic called Abbotsford Falls Health Center. It's in Germantown. We have 23,000 patients in our network. We have 6 health centers across Pennsylvania. Because of the Affordable Care Act, we have reduced our uninsured rate from 25% down to under 10%. Across the country, we see the same thing happening. People are getting on insurance. We have 20 million Americans now insured because of the Affordable Care Act. Because of the ACA, my patients don't talk to me about medical debt because the insurance companies could no longer propose annual lifetime caps on insurance benefits. My patients are less likely to be admitted to the hospital with congestive heart failure or with diabetes or with other problems because quality measures in ObamaCare have made it so that hospitals have to do a better job in discharging patients, otherwise they don't get reimbursed. So my patients benefit from that. Our health center, we have 5 health centers. We were able to open a 6th health center because of the Affordable Care Act in York, Pennsylvania. Senator Toomey should know about York. It's on the front lines of the opioid crisis. And I'm on call every few months, and I get calls from York. And these patients would not have been helped without the Affordable Care Act. I want you guys to know how many patients are covered in Pennsylvania because of the Affordable Care Act. 1.1 million patients. So we talked about 20 million patients getting covered because of the ACA. 1.1 million of those are in Pennsylvania. If we have the Affordable Care Act replaced, 3,000 of my patients, as I said, are going to lose their health care. Also, we're going to have to lay off people. We have pain management, we have nutritionists, we have nurses, we have behavioral health counselors. They're all going to lose, a lot of them are going to lose their jobs because the patients that we had before that were paying, that had Medicaid, that had health insurance, we were getting reimbursed for that. We're going to have to eat those costs because they're not going to have health insurance. This is also nothing to say about people with pre-existing conditions and people that were hard-pressed to find health insurance before the Affordable Care Act. I know Senator Toomey is concerned about abortion. With the repeal of the Affordable Care Act, we're going to have more abortions because people are going to lose family planning. They're going to lose contraceptive coverage. Insurances are going to be able to implement unreasonable rate hikes with the repeal of the Obamacare, and also to discriminate based on gender and pre-existing conditions, as I mentioned. Another thing that really bothers me about this administration's effort to repeal Obamacare is just last week they reduced the amount of time, the window period, to sign up for Obamacare. It used to be 90 days, they cut it down to 45 days. My wife was actually able to get insurance under Obamacare, and it was because of that window period that we had some time to get her signed up because we had her sign up in the latter half of that window. That's just one story. Mostly of Obamacare, I think we saw in those numbers, people are signing up in those last days. So that's going to be thousands, hundreds of thousands, millions of people that are not going to have health insurance because of that. On a day-to-day basis, I don't see politics, I see patients. I see how Obamacare has worked, and I see how Obamacare has helped them. I just want to briefly talk about, I had a patient that I treated that didn't have health insurance. We were able to get him signed up for Obamacare, and because of Obamacare, he was able to be treated for hepatitis C, which he had. Before that would have been considered a pre-existing condition, he wouldn't have been able to get covered. I had another patient that came in. He was able to qualify for the Medicaid expansion. He had chronic knee problem. That led to addiction on opioid medications. We were actually, because of his coverage, we were actually able to get him surgery, and that problem was fixed. Finally, I had a patient that needed eye surgery, had cataracts, he had high blood pressure. He did not have health insurance. He was independently employed. He bought Obamacare. This is a working class guy, didn't have a lot of money to throw around. Wasn't happy about the fact that premiums were expensive, but he actually was able to get some of the federal dollars to help pay for the premiums, just like 85% of Americans. So overall, he was happy with it. So Senator Toomey, I agree with you that there can be improvements. Some of the with our current health system. Some of the things you had mentioned, you talked about insurances competing across state lines, talking about going after frivolous medical lawsuits, talking about letting people deduct their health bills from their taxes. I think those are all ideas where you could probably find bipartisan support. But a repeal of the Affordable Care Act is going to be devastating. Just a couple more facts I want to throw at you. With the repeal of ObamaCare, in Pennsylvania we lose 137,000 jobs. Across the country, that's 1.1 million jobs. Our gross state product is going to drop by $76 billion. We're also going to lose $1 trillion from our economy. And most important for me, and this has been documented in the New England Journal of Medicine and also in the Pennsylvania Budget and Policy Center. We're going to lose about 5 American lives an hour with a repeal of Obamacare without an appropriate replacement. So Senator Toomey, I ask for you to stand with us to protect my patients' access to affordable health care, because for my patients, this is about life and death.